Your body is sending you warning signals right now that you are probably ignoring not dramatic symptoms like chest pain or sudden weakness, but subtle changes that seem too minor to worry about. A gradual decrease in your exercise tolerance, slightly elevated blood sugar readings that are not quite diabetic yet, blood pressure that has crept up from 120/80 to 135/85, a waist measurement that has increased by 2 inches over the past 5 years, mild but persistent inflammation showing up as elevated C-reactive protein on routine blood work. These are not acute medical emergencies. They do not require immediate hospitalization. They do not cause pain or obvious disability, but they are powerful predictors of what your health will look like in 5, 10, or 20 years. These silent problems are the precursors to heart disease, stroke, diabetes, dementia, cancer, and premature death. They develop gradually, accumulating damage year after year while producing symptoms so mild that they are easily dismissed as normal aging or stress. By the time they progress to diagnosable disease, years or decades of preventable damage have already occurred. What makes these problems particularly dangerous is their silence. Loud health problems get attention and treatment. Silent ones are ignored until they become loud, by which point reversing the damage is far more difficult and sometimes impossible. The critical insight is this: addressing silent health problems while they are still silent is the most effective form of preventive medicine. Waiting until they become symptomatic is reactive medicine that comes too late to prevent the worst outcomes. Hi, I am Dr. Alex. I am an emergency medicine doctor, and after nearly 10 years working in AAN, EDE, I can tell you with certainty that the patients I see with heart attacks, strokes, diabetic emergencies, and other acute medical crises, almost all had silent warning signs for years before the event. Borderline blood pressure that was never treated, prediabetes that was noted but not taken seriously, slowly increasing waist circumference that was accepted as normal weight gain with age, chronic low-grade inflammation that was never investigated. These silent problems are not mysterious. They are detectable, measurable, and modifiable. But they are routinely ignored because they do not feel urgent. People wait for symptoms to become severe before taking action. By that point, the intervention required is more aggressive, less effective, and often too late to prevent permanent damage. My goal is to help you understand which silent health problems predict your future most accurately, so you can address them now while they are still reversible, rather than waiting until they become crises. Now, before we continue, I want to make you a promise. I am going to give you the most thorough, clinically grounded explanation of predictive health markers that I can. Everything I share is based on current medical evidence and my own clinical experience, seeing thousands of patients progress from silent problems to serious disease. What I ask in return is simple. If you want to prevent disease rather than just treat it after it develops, hit the subscribe button right now. This channel is dedicated to helping you understand the early warning signs that predict future health, so you can take action before damage becomes irreversible. If you watch this entire video and you have not learned something that could genuinely change your health trajectory, you can unsubscribe. No hard feelings. But if you give me your attention, I will give you everything I've learned about identifying and addressing silent health problems before they destroy your quality of life. So please subscribe now to help this channel reach more people who need this information. Let us talk about the 5 silent problems that predict your future. The first silent problem is insulin resistance, which affects an estimated 40 to 50% of adults, but remains undiagnosed in most cases because standard blood tests only detect it after it has progressed significantly. Insulin resistance occurs when your cells stop responding properly to insulin, forcing your pancreas to produce more insulin to achieve the same blood sugar control. For years or even decades, this compensation works. Your blood sugar stays normal because your pancreas is pumping out 2, 3, or 4 times the normal amount of insulin. Standard fasting glucose tests show normal results. You are told you are fine, but you are not fine. The hyperinsulinemia, the chronically elevated insulin levels, is driving a cascade of metabolic problems throughout your body. High insulin promotes fat storage, particularly visceral fat around your organs. It raises blood pressure by causing your kidneys to retain sodium. It increases triglyceride production in your liver and lowers HDL cholesterol, creating an atherogenic lipid profile. It promotes inflammation and oxidative stress. It increases cancer risk because insulin is a growth factor. And it accelerates cognitive decline because high insulin impairs brain glucose metabolism. All of these effects are occurring while your fasting glucose is still normal and you have no obvious symptoms. Eventually, your pancreas cannot keep up with the demand, insulin production begins to fail, blood sugar starts to rise, you progress through prediabetes and into type 2 diabetes. But by this point, you have already had insulin resistance for 10 to 20 years, and all the damage from that chronic hyperinsulinemia has already accumulated. The predictive power of insulin resistance is extraordinary. People with insulin resistance have dramatically higher rates of cardiovascular disease, dementia, cancer, and all-cause mortality compared to those who are insulin sensitive, even when blood sugar is still normal. The problem is that insulin resistance is rarely tested for. Fasting glucose is checked, but fasting insulin is not. Hemoglobin A1C is checked, but insulin levels are not. The standard screening misses the problem entirely until it has progressed to diabetes. There are ways to detect insulin resistance earlier. Fasting insulin levels above 10 microunits per milliliter suggest insulin resistance. A triglyceride to HDL ratio above 3 suggests insulin resistance. Waist circumference above the healthy threshold strongly correlates with insulin resistance. But these tests are not part of routine screening. You have to specifically request them or have a physician who understands metabolic health well enough to order them proactively. The solution to insulin resistance is lifestyle modification targeting the root causes, reducing refined carbohydrate and sugar intake, implementing time-restricted eating to lower insulin levels for extended periods each day, resistance training to build insulin-sensitive muscle tissue, weight loss if overweight, particularly reduction of visceral fat. These interventions reverse insulin resistance when implemented consistently, but they only work if the problem is identified in the first place. The second silent problem is chronic low-grade inflammation, often called metaflammation or metabolic inflammation. This is distinct from acute inflammation that occurs with injury or infection. Chronic inflammation is a persistent, low-level activation of the immune system that damages tissues throughout the body over years and decades. It is measured through biomarkers including C-reactive protein, interleukin-6, and tumor necrosis factor alpha. Elevated CRP, particularly high-sensitivity CRP, above 3 mg per litre, predicts future risk of heart disease, stroke, diabetes, dementia, and cancer more accurately than many traditional risk factors. The mechanisms involve damage to blood vessel walls, promotion of insulin resistance, disruption of normal cellular function, and creation of an environment that supports cancer development. Chronic inflammation is driven by several factors. Visceral fat is metabolically active and produces inflammatory cytokines continuously. Poor diet, particularly diets high in refined carbohydrates, sugar, and omega-6 fatty acids from vegetable oils, promotes inflammation. Lack of physical activity allows inflammation to persist unchecked. Chronic stress elevates cortisol, which paradoxically increases inflammation over time. Poor sleep disrupts immune regulation and increases inflammatory markers. Gut dysbiosis, an imbalance in gut bacteria, triggers immune activation and systemic inflammation. Environmental toxins and pollutants activate inflammatory pathways. The result is that most adults over 50 have some degree of chronic inflammation, and many have significant elevation that is actively driving disease progression. The insidious aspect of chronic inflammation is that you cannot feel it. Unlike acute inflammation, which causes pain, redness, and swelling, chronic low-grade inflammation produces no obvious symptoms until the accumulated damage manifests as disease. You do not know your CRP is elevated unless you specifically test for it. Most routine blood work does not include inflammatory markers. Even when CRP is checked and found to be elevated, it is often dismissed if there is no obvious infection or injury causing it. But persistent elevation of inflammatory markers in the absence of acute illness is not something to dismiss. It is a warning sign that chronic disease processes are active and progressing. Addressing chronic inflammation requires identifying and removing the sources, losing visceral fat through diet and exercise, shifting to an anti-inflammatory dietary pattern, emphasizing whole foods, omega-3 fatty acids, and minimizing processed foods and refined carbohydrates. Engaging in regular physical activity, which has potent anti-inflammatory effects. Managing chronic stress through consistent practices. Improving sleep quality and duration. Addressing gut health through fiber intake and possibly probiotic foods. The intervention is not a single medication or supplement. It is a comprehensive lifestyle approach that removes inflammatory triggers and supports normal immune regulation. The third silent problem is declining exercise capacity, measured most accurately through VO2 max, which is the maximum amount of oxygen your body can utilize during intense exercise. VO2 max is one of the strongest predictors of all-cause mortality and cardiovascular disease mortality available. Research published in JAMA shows that each 1 unit increase in metabolic equivalence, which correlates with VO2 max, is associated with approximately a 12% reduction in mortality risk. People in the lowest fitness quartile have 4 to 5 times the mortality risk of those in the highest fitness quartile, even after controlling for other risk factors including smoking, diabetes, and hypertension. What makes VO2 max such a powerful predictor is that it reflects the integrated function of your cardiovascular system, respiratory system, and muscular system. High VO2 max means your heart pumps efficiently, your lungs exchange oxygen effectively, your blood vessels deliver oxygen to tissues, and your muscles utilize that oxygen to produce energy. Low VO2 max means one or more of these systems is compromised. VO2 max declines with age, typically at a rate of about 10% per decade after age 30 in sedentary individuals. This decline accelerates after age 50. By age 70, many sedentary adults have lost 50 to 60% of their peak aerobic capacity. This decline is not inevitable. It is largely driven by physical inactivity. People who remain active throughout life maintain much higher VO2 max into older age. The problem is that the decline happens gradually and is easily rationalized as normal aging. You notice you are more out of breath climbing stairs than you used to be. You avoid activities that require sustained exertion. You attribute this to getting older. You do not recognize it as a warning sign that your cardiovascular system is deteriorating and your mortality risk is increasing. Unlike the other silent problems which require blood tests to detect, exercise capacity can be assessed through simple functional tests. How many flights of stairs can you climb continuously without stopping? Can you walk briskly for 30 minutes without becoming excessively short of breath? Can you perform physical tasks that you could easily do 10 years ago? If your capacity has declined noticeably, your VO2 max has declined, and your mortality risk has increased. The solution is progressive aerobic and resistance training. Starting from your current fitness level and gradually increasing intensity and duration over weeks and months. Studies show that even older adults in their 60s, 70s, and 80s can significantly improve VO2 max through consistent training. The improvements in mortality risk follow the improvements in fitness. As your exercise capacity increases, your longevity improves measurably. The fourth silent problem is arterial stiffness, also called vascular aging, which occurs as arteries lose elasticity and become less compliant over time. Flexible, compliant arteries absorb the pressure pulse from each heartbeat and deliver blood smoothly to tissues. Stiff arteries transmit pressure waves forcefully, increasing the workload on the heart and damaging small blood vessels in vulnerable organs, including the brain, kidneys, and eyes. Arterial stiffness is measured through pulse wave velocity, which quantifies how fast pressure waves travel through arteries. Higher velocity indicates stiffer arteries. Research shows that arterial stiffness predicts cardiovascular events, stroke, dementia, and mortality independent of traditional risk factors like blood pressure and cholesterol. The mechanisms involve both structural changes in arterial walls and functional changes in endothelial cells that line the arteries. Collagen and elastin, the proteins that give arteries their flexibility, become damaged and degraded. Calcium deposits accumulate in arterial walls, literally hardening the arteries. The endothelium loses its ability to produce nitric oxide, which normally keeps arteries relaxed and dilated. Inflammation and oxidative stress accelerate these processes. The primary drivers of arterial stiffness are hypertension, which mechanically stresses arterial walls, diabetes, and insulin resistance, which damage endothelium through glycation and oxidative stress. Smoking, which introduces massive oxidative stress and impairs endothelial function. Chronic inflammation, which damages arterial structure. And sedentary lifestyle, which reduces the mechanical stimulation that maintains arterial compliance. Arterial stiffness progresses silently over decades. You cannot feel your arteries becoming stiffer. The first indication is often an adverse event like a stroke or heart attack that occurs because stiff arteries could not adequately buffer blood pressure fluctuations, or because the increased cardiac workload led to heart failure. The good news is that arterial stiffness, while progressive, can be slowed or partially reversed through intervention. Blood pressure control is critical. Keeping systolic pressure below 120 significantly reduces the mechanical stress driving arterial stiffening. Regular aerobic exercise improves arterial compliance through repeated mechanical stimulation of vessel walls and improved endothelial function. Resistance training, somewhat surprisingly, also improves arterial compliance when performed correctly. Dietary interventions that reduce inflammation and oxidative stress, including increased omega-3 intake, higher fruit and vegetable consumption, and reduced processed food intake, all improve arterial health. Smoking cessation is essential as smoking accelerates arterial stiffening dramatically. The challenge is that arterial stiffness is rarely assessed clinically. Pulse wave velocity is not part of routine screening. Blood pressure is checked, but arterial compliance is not. As a result, most people have no idea whether their arteries are aging faster than their chronological age would suggest. The fifth silent problem is cognitive decline, which begins decades before dementia becomes clinically apparent. Most people think of cognitive decline as something that happens to older adults in their 70s and 80s. The reality is that brain changes associated with Alzheimer's disease and other dementias begin in the 40s and 50s, or even earlier. By the time memory problems are severe enough to interfere with daily life and warrant a dementia diagnosis, the brain has already accumulated 15 to 20 years of pathological changes. The early stages of cognitive decline are subtle. You notice you are more forgetful than you used to be. You have more difficulty concentrating. You struggle to find words occasionally. You attribute this to stress or normal aging. You do not recognize it as the beginning of a neurodegenerative process that will continue to progress if not addressed. The pathological changes underlying dementia include accumulation of amyloid plaques and tau tangles in the brain, loss of synaptic connections between neurons, neuroinflammation, reduced cerebral blood flow, impaired glucose metabolism in the brain, and progressive atrophy of critical brain regions, including the hippocampus. These processes are influenced heavily by modifiable risk factors. Cardiovascular disease and risk factors including hypertension, diabetes, high cholesterol, and smoking all increase dementia risk by impairing cerebral blood flow and causing microvascular damage in the brain. Insulin resistance and diabetes create a state of impaired brain glucose metabolism that contributes to neurodegeneration. Physical inactivity reduces blood flow to the brain and eliminates the neuroprotective effects of exercise. Poor diet lacking in omega-3 fatty acids, antioxidants, and other neuroprotective nutrients accelerates cognitive decline. Chronic stress and poor sleep both impair memory consolidation and promote neurodegeneration. Social isolation and lack of cognitive stimulation reduce cognitive reserve and accelerate decline. The predictive power of early cognitive decline is substantial. People who show mild cognitive impairment, defined as measurable cognitive decline that does not yet interfere with daily function, have approximately a 10 to 15% annual risk of progressing to dementia. But even before reaching the threshold for mild cognitive impairment, subtle cognitive changes predict future dementia risk. The challenge is that cognitive decline is rarely assessed systematically in middle-aged adults. Memory and cognitive function are not routinely tested unless someone is already experiencing significant problems. By the time testing occurs, the decline is often advanced. There are screening tools including the Montreal Cognitive Assessment that can detect early changes, but they are not used proactively in younger populations. The interventions that slow cognitive decline and reduce dementia risk are well established. Controlling cardiovascular risk factors aggressively, particularly blood pressure and blood sugar. Engaging in regular aerobic exercise, which improves cerebral blood flow and promotes neuroplasticity. Maintaining social engagement and cognitive stimulation through learning new skills and staying mentally active. Following a Mediterranean-style diet rich in omega-3 fatty acids, antioxidants, and anti-inflammatory compounds. Ensuring adequate sleep, which is when the brain clears metabolic waste products including amyloid, managing chronic stress, and maintaining strong social connections. The earlier these interventions are implemented, the more effective they are at preventing progression to dementia. The mistake that most people make regarding silent health problems is waiting for symptoms to become severe before taking action. Silent problems, by definition, do not cause obvious symptoms early on. If you wait until you feel bad, the problem is no longer silent and has likely progressed significantly. The second mistake is assuming that normal test results mean you are healthy. Standard screening catches problems late. Fasting glucose is normal until insulin resistance has progressed to pre-diabetes or diabetes. Blood pressure might be borderline high, but not yet hypertensive. While arterial damage is accumulating, cholesterol might be acceptable while inflammation is driving atherosclerosis. Normal results on standard tests provide false reassurance when more sensitive markers would reveal problems. The third mistake is accepting gradual decline as normal aging. Some decline with age is inevitable, but the rate and severity are highly variable and largely determined by lifestyle factors. Rapid decline is not normal, it is pathological, and it is often preventable or reversible. The fourth mistake is fragmenting health management into separate silos. Cardiovascular health, metabolic health, brain health, these are not independent systems. They are interconnected. Insulin resistance drives inflammation, which damages blood vessels, which impairs brain function. Addressing health comprehensively, rather than treating each system separately, is far more effective. The fifth mistake is underestimating the power of lifestyle intervention. Medications have their place, but for silent health problems, lifestyle changes are often more effective than pharmaceutical approaches. Diet, exercise, sleep, stress management, these are not alternative medicine. They are fundamental interventions that address root causes rather than just managing symptoms. So what should you actually do to identify and address these silent problems? The first step is comprehensive screening that goes beyond standard blood work. Request fasting insulin levels or HOMA-IR calculation to assess insulin resistance. Request high-sensitivity CRP to measure inflammation. Get blood pressure checked properly, ideally with ambulatory monitoring, to capture true average blood pressure rather than isolated clinic readings. Assess your exercise capacity honestly through functional tests or formal VO2 max testing, if available. Consider cognitive screening if you have risk factors or notice any changes in memory or concentration. The second step is to address findings proactively, even if they are borderline. Borderline high blood pressure should be treated with lifestyle intervention immediately, not monitored passively while it progresses. Prediabetes or insulin resistance should trigger aggressive dietary and exercise changes, not watchful waiting. Elevated inflammatory markers warrant investigation into causes and implementation of anti-inflammatory strategies. Declining exercise capacity should prompt a structured fitness program. The third step is to implement comprehensive lifestyle changes rather than isolated interventions. Address diet, physical activity, sleep, and stress management simultaneously. These interventions are synergistic. Improving one makes the others more effective. The fourth step is to monitor progress through regular reassessment. Retest inflammatory markers, insulin sensitivity markers, blood pressure, and exercise capacity every 6 to 12 months to verify that interventions are working. Adjust strategies based on results. The fifth step is to recognize that prevention is an ongoing commitment, not a short-term project. Silent health problems develop over decades. Reversing or preventing them requires sustained lifestyle changes maintained for years or decades. But the investment is worthwhile because the alternative is progressive disease, disability, and premature death. Let me bring this back to the clinical reality. In the emergency department, I see the end results of ignored silent health problems. The 55-year-old with a massive heart attack who had borderline blood pressure and pre-diabetes for 10 years but never took it seriously. The 68-year-old with a stroke who had insulin resistance and chronic inflammation for 15 years but was told everything was fine because fasting glucose was normal. The 72-year-old with advanced dementia who had cardiovascular risk factors and declining cognitive function for 20 years but received no intervention until the diagnosis was made. These outcomes were preventable, every one of them. The warning signs were there years or decades before the crisis, but they were silent, so they were ignored. What is tragic is not that the outcomes were inevitable, they were not. What is tragic is that simple, accessible interventions could have changed the trajectory entirely, but they were never implemented because the problems did not seem urgent. Here is the bigger picture. Your future health is being determined right now by processes that are largely invisible and asymptomatic. Insulin resistance, chronic inflammation, declining fitness, arterial stiffening, and early cognitive decline are actively shaping whether you will be healthy, functional, and independent in your 60s, 70s, and 80s, or whether you will be disabled by cardiovascular disease, diabetes, dementia, and other chronic conditions. These processes are not mysterious, they are measurable, they are modifiable, they respond predictably to specific interventions, but they require attention and action while they are still silent. The decision you face is whether to wait until symptoms force intervention or to identify and address problems now while they are still reversible. The first path leads to disease management. The second path leads to disease prevention. Both require effort, but one provides dramatically better outcomes. So here is what I need you to do. First, if you found this information valuable, please subscribe to this channel right now. I am committed to creating content that helps you prevent disease rather than just react to it after it develops. Understanding silent health problems is essential for anyone who wants to age well rather than just age. Second, schedule a comprehensive health assessment that includes the markers discussed. Do not settle for standard screening that only catches problems after they have progressed significantly. Third, if any silent problems are identified, implement aggressive lifestyle intervention immediately. Do not wait for them to become worse. Fourth, commit to reassessing regularly to monitor progress and adjust interventions as needed. Finally, share this information with people you care about. Most people have no idea that the problems that will determine their health decades from now are already developing silently. By spreading this knowledge, you help others avoid preventable disease and disability. Thank you for watching, and I will see you in the next video.